Hi, I'm Joan Justice with HealthWorks Collective, and I'm here with Martha Bebinger from WBUR in Boston, which is Boston's NPR news station. Martha covers healthcare news for WBUR, and she's also the creator of HealthCareSavvy.com, which is WBUR's community of patients that are starting to shop for healthcare. Martha, tell us how you got started with Healthcare Savvy, what your mission is, and how you're helping patients shop for care.
Well, Joan, first of all, thank you so much for paying some attention to the site and for giving me this opportunity to talk about it. It's very, very kind, and I appreciate all the work that you are doing in this regard. So in Massachusetts, we are spending a lot of time trying to figure out how to bend the cost curve in the parlance of the industry language. But while patients are really at the center of that project, there's a lot of confusing information and very little guidance for them about how to be active participants. So for example, in Massachusetts, we have insurance products that charge you more to go to a higher priced, lower quality hospital, but it's almost impossible to find the information you need to understand what hospital is in that category and why. So Healthcare Savvy is an attempt to create the water cooler conversation for patients about all of the conflicting information and confusing decisions that they're having to make in this realm right now. It offers some resources for places where you can get some price information, although it is still hard to find. It offers some guidance, a little bit of a how to have a conversation with your doctor about these things. And it offers a place for patients to share stories, because really, my feeling is that we're all going to learn from each other about whatever this new phase in healthcare is going to look like. As an example, we've had stories from patients who scheduled their dental care in increments so that it would be covered by their plan in different years. Who did research on the level of anesthesia they would need to actually get through the procedure without too much pain, realizing that the charge for a lot of anesthesia is a lot more than the charge for less anesthesia. We have patients who call up and try to find the prices for different services and are stunned that in Massachusetts the price can vary 3, 4, or 5 times. You don't know that up front usually, and that price is very often not tied to quality.
Right.
So patients are starting to experiment and make some forays into this world of how healthcare is priced and what the price is all about, but it's hard to do. And so sharing their experiences on the site, I think, is very helpful. We have people who shop for insurance and explain how that decision rolls out for them. Like, what does it mean to have a higher deductible or lower deductible? What are the trade-offs that you're making there? These are questions that people wrestle with all the time, and particularly now in this open enrollment period. So it's very helpful, I think, for people to have a place to come in and have a conversation about that. I might just say one other thing about why I started the site, which is that I'm a reporter. I'm a reporter at a time when the media is changing a lot, when we are trying to find the place where the traditional media reporters and the kind of citizen journalists are coming together. And Healthcare Savvy is a way for me to try to understand that, try to figure that out, how to work with people who are usually the subjects of my stories, but now who are becoming the drivers of the stories at the same time. And so I'm having a great time trying to understand what the new world of journalism might look like through this site, as well as what the new world of healthcare might look like. So what kind of reaction are we having? We're hearing from a lot of doctors and patients who think that this kind of place to have a conversation is very helpful. Quite candidly, I'm getting a lot of posts from marketers, I think, who are trying to make their pitch to patients about how to deal with insurance exchanges, how to deal with Medicaid and Medicare billing fraud. Medicare, as you know, is a very politicized subject right now, so we have people who are writing about how to choose a Part D plan or other things from many different sides of the political arena. The reaction, I think it is still hard for people to sit down and write about or talk about healthcare, and so that's reflected to some degree in the fact that we have more readers than writers. And what we're getting from people who are ready to write is people who are writing. So now I'm trying to get people I'm trying to help people get to the point where they feel okay, some sort of health literacy, that they feel like they have the tools and the ability to even not just read and try to understand their health insurance policies, but then to write about them. So that's really the next challenge.
Yeah, that's a big one. And health literacy is certainly a huge, important topic. Yes,
Right.
I'm very much into that. But I think your site is great, and I think the share your story part is great, and I urge our readers to go to the site and take a look, because people are intimidated about asking their doctor how much something is, and oftentimes the doctors don't know. And then it's another that brings another whole topic up. So
It takes you to Neil Shaw's post. Yeah.
Yes. Well, Martha, it's certainly a great site, and it's a great step forward in the journey towards cost transparency and price reduction in healthcare. So thank you so much for bringing your site to our attention.
Thanks again for your interest.
Yeah.